One of the things I like to do most is answer questions for people so they can resolve their pain. I think too many people are not getting the proper information, and here's a chance where I could really be very specific to your situation and see if I can guide you towards resolving your pain. So we're going to just take a couple of questions from the audience, and I'm going to see if I can help you. I have pain in my ankle when I run, but not when I walk. What can I do? I think that's actually probably a really good indication that the cause is muscular, because let's say that it was arthritis in the joint, then whether you were standing or running wouldn't matter. The pressure of your weight bearing would actually cause the arthritic change to emit pain. So I think this is actually an indication of someone who's having a muscular cause. I think the thing that most people don't understand is that your ankle muscles are actually very strongly related to your hip muscles. So your hip muscles, when you're standing to push off and allow you to walk or run, are strongly involved in supporting you. If they can't perform the support properly, then it's going to create a greater load on the ankle muscles and could cause the ankle muscles to break down. So although you are experiencing pain at the ankle, more than likely the cause of the pain are weak hip muscles. So what I would suggest is strengthening of the hip muscles and the ankle muscles. But in this case, I would definitely say that the cause is muscular. How do you exercise your hand to relieve joint pain in your fingers? Oh, this is a good one. I love this one. Okay. The reason this is so critical is because when someone has pain in their joints, the natural tendency is go to a rheumatologist. The rheumatologist is going to do an x-ray, and they're going to find some form of arthritic change, right? And they're going to tell you the arthritis is the cause of the pain. Why? Because we found it on an x-ray. And you're going to be set up for some cortisone shots or some kind of anti-inflammatory medicine. The thing I want you to understand is that you actually have muscles that flex your hands and extend your hands that run all the way from the elbow to the digit right here, to the end of the joint right here. So if this muscle were to strain, what's going to happen is it'll have a tendency to shorten. When it shortens, it's going to pull all the way from its attachment to the elbow all the way to the last part of your finger. So it's going to shrink. Now, when it shrinks, it takes the joint surfaces and compresses them so that when you're trying to bend your fingers, there's too much compression and the joint surfaces rub excessively. So in the vast majority of cases that I've treated, when the person had pain at joints, it was typically due to strained either extensor muscles of the fingers or flexor muscles of the fingers. So to resolve the situation, I mean, even the most simple thing is just to practice a stretch, and that's how you could prove that it is muscular. You stretch the extensors like this and the flexors like this. And simply doing that stretch, if you were to see a decrease in the pain at the finger joints, I mean, it's pretty much a guarantee that that causes muscular, and then just the appropriate targeted strengthening of the appropriate muscles would stop the tendons from shortening and emitting the pain at the fingers. So I'm telling you now that in the majority of cases, the cause of pain at your joints at your fingers is muscular. And it's a simple way of testing. Just do the stretch. If the pain resolves, you know that the cause is muscular. How would you relieve a hip injury with constant knee pain on the same side? That's a good one. Okay, so when someone talks about hip and knee pain on the same side, usually, well, first off, most people aren't quite aware of where the hip joint is. Oftentimes they'll call this the hip joint, but the hip joint actually is kind of lowish. It's actually right here. And so when they have hip and knee pain, there is a possibility that there is a muscle called the tensor fasciae latae. It's really a tiny muscle, but it connects to a band of connective tissue that runs from the hip joint all the way down to the knee. So if your hip muscle weakens, this muscle called the gluteus medius, the muscle that supports you when you're standing on that leg, this other muscle and connective tissue can have a tendency to shorten and tighten. So you could have pain from its attachment near the hip, its attachment near the knee, or even the entire length of your lateral thigh. So when someone starts talking about this idea of having pain at the hip and the knee on the same side, I start thinking that, again, it's this hip muscle which supports you, straining, causing this connective tissue band to strain and emit pain. So again, I hate to say it, but the same answer is strength training, strengthening the appropriate muscles. In most cases, when we're talking about pain and dysfunction, You always seem to be saying that the pain is occurring as you're performing an activity. It's almost like it's a red flag that the tissue that's connected to these two things is muscle. Unfortunately, again, as I've stated, these type of situations cannot be diagnosed through diagnostic testing. So you really have to kind of understand the body, how it works, how muscles integrate and are related to function. When I lie down at times, I get such sciatic pain in my legs. What can I do? Wow, this is a big one. Okay, sciatica is huge. 40 million people are estimated to suffer from it a year. The problem is that, as a general rule, the medical establishment continues to promote the idea that sciatica, which is, you have to know what the symptom is, which is pain from the buttock region, it has to pass the knee. You can't let anyone tell you that pain that runs from the buttock to, say, the back of the thigh or even to the knee is sciatica. It has to pass the knee at least down to the mid-calf, most likely down to the foot. Okay? So that's what sciatica is. Now, you'll be told that the cause of the pain is a herniated disc or stenosis or something in your spine. The problem I have with that is that, and this is what you really need to understand, the sciatic nerve doesn't attach to your spine. There's actually no such thing as a nerve attaching to the spine. You have your spinal cord, and what comes out of the spinal cord are nerve roots, one at every level. Those nerve roots join together to create nerves. The sciatic nerve actually actually starts right here at the gluteal region. That's where it starts. That's why when people have sciatica, typically they're saying, I don't have back pain, I have gluteal region pain. So the reason the sciatic nerve actually becomes strained and impinged by the piriformis muscle, this muscle in the butt, is because the muscle, again, that supports you when you're standing at the hip, this glute med, actually strains, and the piriformis actually tries to compensate. It's trying to help out, but it can't. So it strains, emits pain, thickens, and then impinges on the sciatic nerve. So someone who's having sciatica in both legs, I would guess, is someone who's having a lot of difficulty with weight-bearing activities like walking. You might even find, remember I talked about that compensation? That person typically is someone who might be walking like this. You'll see that side bend thing, that's called the Trendelenburg. But basically, this is someone whose hip muscles are so weak. What it's supposed to look like is that when I stand, my pelvis is level and I can stand. But when that muscle's weak, it causes my hip to drop, and my body doesn't want that to happen because I would fall. So it actually takes my weight and brings it to the side I'm standing on. And if it's bilateral, that's what it's going to look like. So my guess is that's what that person's looking like, and it's really just another indication that that glute med is weak. Appropriate strengthening, strengthen the glute meds. The piriformis will never have that chance to break down and emit pain. That's how you stop sciatica. I mean, I've done it for people in less than a week. That lady Helene I talked about, I've had other people. One lady was planning on going on a walking tour to Russia. She came in less than a week. She showed up with sciatic pain. She couldn't even stand, needed a cane. A week later, she went on the walking tour. I've had people who have had sciatica. It's crazy, man. You get surgeries, 3, 4 surgeries to the spine, pain medications, the whole thing. They show up. I show them the cause is the glute med. We do some strengthening. It resolves. So sciatica must be perceived as hip dysfunction. It is associated with your hip. It has nothing to do with your spine. Should never be perceived as spine and should have nothing to do with any structural variation. Don't ever let anyone tell you something from your spine is causing sciatica. Is it possible to strengthen the knee to reduce your pain and avoid a total knee replacement? Oh boy, is that the truth. There is no question of that. So here's the concept I want you to understand about the knee and pretty much every joint. When we're talking about the knee, we're really kind of looking at the kneecap as it runs through the joint. And when you bend your knee and straighten your knee, that kneecap runs through there, right? So you really have to start looking at, well, what is the mechanism that that kneecap works? What tissue actually controls that? And it turns out it's your front thigh muscle. Your front thigh muscle is attached by what is known as the quad tendon to your kneecap. So when you're bending your knee or straightening your knee or even standing, it is the quad that is controlling the position of that kneecap. If there's a strain of your quad muscle, your front thigh, or even if the hamstring isn't strong enough, it can cause the quad to shorten. When this shortens, it can pull up on your kneecap. It's attached to the kneecap. That excess force pulling up on the kneecap will compress the kneecap into the joint. So instead of kind of casually gliding through the joint when you're bending your knee, it's compressed, and clearly it doesn't like that. That's what causes pain in the knee. So probably the most common cause is this muscle imbalance between the front thigh muscle, which we use for everything, and the hamstring being weaker. Stretch the quads, strengthen the hamstring, and I'm telling you, in the majority of cases, you're going to resolve your pain. And it doesn't take long. I always tell people, you want to see if I'm right? Maybe this guy's out of his mind. I don't know. Why don't we just take a look? Real simple. Just stretch your quad. Stand there, grab your knee, bend, hold it for 20 seconds. Your pain goes down or reduces. What do you think the answer is there? I didn't give you a knee replacement or anything, right? I just stretched your quad. I took the tension off the kneecap. It allowed it to glide with the proper tension. No more pain. Can anything help nerve damage due to carpal tunnel and spinal stenosis? Oh, these are great, great questions. This is everything I love to talk about. Can we, okay, so I'm just going to do the carpal tunnel first, okay? And then I'll hit the spinal stenosis. Carpal tunnel syndrome is told to you that the cause is that the median nerve is the nerve that runs through the carpal tunnel right here. And so what happens is the other thing that runs through the carpal tunnel are the tendons that bend the wrist and close the hand. So you have the median nerve and some tendons. Okay, so first of all, when we're talking about what the cause is, well, if you go to the typical person, orthopedist or whoever, they're going to tell you that somehow the aspect of the tunnel, which is known as the flexor retinaculum, it's called the carpal tunnel because part of it is the carpal bones, the wrist bones. The other side of it is something called the flexor retinaculum, and it runs right here. That's what makes it up. That's where the nerve runs through. So they're going to tell you that the answer to resolving your pain is to get surgery and slit the flexor retinaculum. And their answer is somehow by weakening the carpal tunnel, it will allow there to be more room for these tendons and the median nerve to run through them. The problem I have is that there's like no possible indication that that flexor retinaculum has ever even altered the tension in it. So I can't even imagine why anyone would think that would be beneficial. The more logical answer is that you have these tendons from these muscles running through the tunnel with the median nerve. And what does everyone always tell you is the cause? Repetitive motion exercises, right? Everyone knows that. It's repetitive. Well, what tissue is the repetitive motion exercise being performed by? It's muscle, right? So more likely what happened was you strain the muscles, cause them to thicken, cause the tendons to impinge on the nerve, and that's why you're getting the symptom. So the answer isn't to do surgery and elongate the flexor retinaculum. It's to strengthen, actually, the opposing muscles here. These are the wrist extensors. So if I strengthen these, what I'm doing is creating more tone towards the opposite side of this. What does that do? It lengthens these. If I strengthen here, it lengthens here. What does it do? It shrinks the size of the tendons. It makes a nice, plenty of space in the tunnel, and the median nerve has plenty of room to move through, and you've resolved your carpal tunnel. I just want to make one quick point about carpal tunnel. So this is very, very common. People will be told that they have symptom in their entire hand. Your entire hand's numb. And you go and someone does what's known as an EMG, this electromyography. It's a test to see about speed of nerve conductivity. So they'll find that you have slow nerve conductivity of the median nerve, and they'll say, oh, that's the cause of your pain. What they've neglected to mention to you is that the median nerve innervates here, 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 and half of here, only on the palm side. The half of the ring finger and the pinky on the palm side and the other side are the ulnar nerve, and these 3.5 fingers on this side are the radial nerve. 3 different nerves. So if someone's having symptoms in their entire hand, and you know that the median nerve only innervates this, 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 and half of this on this side, how could the median nerve be the cause of your symptom? It's impossible. Your symptom is outside the area that the nerve innervates. You see the psychotic nature of this? So you get carpal tunnel syndrome surgery, and magically you still have your symptoms. And then you go to the next doctor. Oh, I don't know what happened. The guy said it was that, and I did that, and I still got the symptoms. And you follow the path. Because nobody's trying to diagnose based on your symptoms. That's what I do. That's what I created. I'll tell you, you come to me and you say, it's the craziest thing. Half my finger here and this finger is numb. I say, well, that sounds like the ulnar nerve because that's where it innervates. I say, you've got it on this side and just these fingers. I say, well, that sounds like exactly where the radial nerve innervates. We should look for that. If you have symptoms in your entire hand, and sometimes people describe it as the entire arm to the fingers, there's only one place where you can have that much nerve compression, and it's not your cervical spine. It's right here at the front of your neck. It's an area called the anterior triangle of the neck, and all the nerves that come out of your neck called the cervical nerve roots join together to form what is called the brachial plexus. It is every nerve that innervates your entire arm and hand, and it runs right through this triangle. And there's a muscle right here that makes up the triangle called the anterior scalenes. And when that muscle thickens and strains, it impinges on the brachial plexus. And that's why you get symptoms all the way down your arm. If you're having it down both arms, I would guess you would find, guess what? You have forward head and shoulder posture. Because look what happens to that anterior triangle when you get forward head and shoulder posture. You close it. You close it off. You are literally inciting that symptom to occur. If you have it in one arm, it's typically a rotator cuff issue, which is causing a certain imbalance and weakness in the back of the shoulder. That allows that arm to come forward. You create the compression of the brachial plexus. So when I say know your symptoms, what I'm really saying to you is you will never get the right treatment unless you can coordinate those symptoms with the proper tissue emitting the symptom. That's really what this is all about. And again, I tell everybody, I don't know why 20 years ago I went to medical school and I said, what they're saying is just wacky, and I can't follow that. I've got to try to find this path, but I did, and I was able to figure this out, and as far as I'm concerned, it is to your benefit, so I am always honored to do this for people. Oh, thank you. Thank you. Let me just hit you up about the stenosis. Stenosis, the word stenosis actually just means narrowing. That's all the word means. It's very technical. There's a lot. Spondylolisthesis, spondylitis, stenosis. Very fancy. As far as I'm concerned, it's a way of trying to deceive you by saying a lot of technical things that you might not understand, and unfortunately you just might go along with because you think they know what they're talking about and they're out for their best interest. So that's why I'm all about giving you the information. So stenosis means narrowing. So what happens is here's your spinal cord. Here are the nerve roots coming out at every level. And sometimes you will hear about stenosis of the spinal cord, but that's rare. What you typically hear about is what is known as foraminal stenosis. That's basically the little tunnel that the nerve root comes out. So you have back pain in the lower back, and you're told you have an L5 a nerve root impingement with stenosis. And they say, well, that's in the lumbar region, and since you're having back pain in the lumbar region, that must be the cause. Here's what you got to understand. And you could look this up. I'm not making this stuff up. This is real. This is medical school stuff. There is something called a dermatome. A dermatome is the area of skin that every one of those nerve roots coming out actually innervates. Each one of those innervates a certain area of skin. And you could just Google dermatome, and you'll see there's an actual picture that shows this stuff. So if we were talking about that L5 nerve root, the L5 nerve root doesn't innervate your lower back. All the lumbar region nerve roots innervate your legs. This is L3. This is L4. This is L5, the outer shin. So unless your symptoms are in the outer shin and someone's telling you have a nerve root impingement of L5, that is about the only time I would say, wow, that could be the cause. But here's the craziest part. Let me just show you how simple it is. I kind of talked about this a little bit. Let's say you still don't know anything about this, but the person is saying that there's some kind of structure in the spine causing pain across your lower back. So I kind of pointed this out before. There's this thing called palpation, and it's really easy to do. So If they're telling you that the L5 nerve root is the cause of the lower back pain, what they're saying is that if I press on the spine where the L5 nerve root is, that would then shoot the pain across my lower back. That's what's known as a referred pain. Pain in one spot causing pain in another area. So as I said, try it. You'll see. You'll never be able to get the pain because that's not really the cause. It just doesn't work. So, but what if you pressed across your lower back and you went, bam, you found that spot and it was really tender? You just, without having any medical background, just proved that the cause couldn't be that stenosis. Because when you pressed on the area where you had the pain, you ignited the pain. So you just proved that it wasn't referred. It's not referred. It's what is known as point tender. The tissue I'm pressing on is the tissue emitting the pain. And guess what? What you're typically pressing on in your lower back is a muscle called the QL, quadratus lumborum. It's the muscle that helps support you when you're standing. That's it. I mean, those muscles are basically responsible to help support you when you're upright. So basically what you did, I press on where they're telling me it is at the spine, I don't get anything. I press on the point where I have pain, and I get it, that's point tender. Forget the MRI finding. It's meaningless. It means nothing in that situation. And that goes to this idea that, unfortunately, whether you have the cause correct or not, these structural variations are going to come up. Over the age of 60, 90% of people have bulging or deteriorative discs. So, I mean, it should be like this ultimate red flag that when you have pain and someone says, well, let's get an MRI, why get the MRI? In 90% of you, I know it's going to show up whether you have pain or not. So what's the point? It's not going to help you diagnose your pain. Interpreting your symptoms, that's the answer. I hope this information helps you and you can live happy, healthy, and pain-free. Thank you.